Hi, I'm Tabitha with DKB Med. Thank you for supporting our Crowning Health program. We're partnering with hairstylists to increase awareness about HIV. Check out this short discussion with HIV expert Dr. Aima Ahonkhai and stylist influencer Michelle-Nichole on how you can talk to your clients about HIV prevention.
It's a real pleasure to be here with you today to talk a little bit about HIV and HIV prevention, especially for Black women in Pennsylvania and the Philadelphia area. So let's get started. First of all, it's really important to know that, like many other chronic diseases, we see really important racial disparities and people living with HIV in the United States. So Black individuals account for 13% of the US population, but 43% of all new HIV diagnoses. Local data and local epidemiology is helpful for framing why it's important to have these conversations with clients in your salon. This number is always quite staggering for me when I look at it. This is about the risk of acquiring HIV. So the data tells us that 1 in 54 Black women will acquire HIV in their lifetime. And that's high in and of itself. So if you think of like 1 in any 54 of your clients, you probably see that amount of clients in a week or two. One of them will acquire HIV in their lifetime if we don't do things differently. But if we compare that number to white women, it's 1 in 874. So that's the disparity we're talking about, and that's where we really want to be able to intervene and reduce that risk for Black women.
That's a huge number, Dr. Ahonkhai.
It really is. Like how many clients do you see on average in a week?
If I see maybe about 30 clients in a week,
okay.
Within that 2-week span, one of them could very much have HIV for all we know.
Right. Exactly. Yeah. So that's well, the thing when you think about the impact you can have and the clients that you see in about 2 weeks, if you can get one person tested or on prevention, which we'll talk about more, then you're really impacting the course of somebody's life. So that's really, really, really powerful.
Yeah, that'll make a huge difference. That number is growing even faster because people don't know.
Yeah, well, it's the disparity that's really not going away. I think because we have really good HIV treatments and HIV prevention, which we'll talk about, when we step back and look at what's been happening over the past decade, over the past 2 decades, we're definitely making improvements in the United States overall. So where we are now in the United States, maybe about 40,000 people or so a year get HIV. That's dropped substantially from what it used to be. What we're not improving on are these disparities that we see in by race. So we're seeing that Black individuals are still acquiring HIV at much higher rates than non-Black, especially than whites. So that's the area where we're not improving. And we know that if we don't do things better in the Black community, we won't be able to actually address ending the HIV epidemic, which is really the goal. Like we can actually end this if we can really make an impact in the Black community. I always tell people HIV is spread through 4 fluids. And so always think about these 4 fluids because there's a lot of scenarios that people are worried about and throw out there that are just irrelevant for HIV transmission. So the 4 fluids are blood, sexual fluids, rectal fluids, and breast milk. And so when we say sexual fluids, that's semen or pre-semen or like pre-ejaculate fluid or vaginal fluids. So those are the 4 fluids we're talking about. And if those fluids are not involved, no transmission is happening. So how is HIV not transmitted? This is what I really want to get through too, because again, if those 4 fluids are not involved, there's no transmission. So it's not through saliva, it's not through tears, it's not through sweating, it's not if you're sharing dishes. I mean, I have so many stories of people separating utensils for the person living with HIV and their families, which, as we can imagine, is so stigmatizing, so dehumanizing, and does not do anything because HIV is not being transmitted that way. Today, what most people take to manage their HIV is one pill. once a day. And there are also even injectable options available for treatment. So we've come such a long way. The medicines that we have today are so well tolerated, like people can take them without having side effects. And in that way, HIV is really a lot more like a chronic disease, because people live with it. People live with it for a long time. We talked about how 1 in 10 people in Philadelphia don't even know they have HIV. So if you don't know you have it, obviously you can get sick. You can be one of those people who develops symptoms and has really bad complications from HIV. You could even die from HIV if you get sick and you don't know you have it. But you can also spread it to other people. So the only way we know what's going on is to get tested. So the recommendation from the CDC is that every adolescent and adult, 13 to 64 years, gets tested at least once. And HIV testing is really easy too. It's good to be familiar with this a little bit, just so people aren't worried about this big dramatic thing. There are a number of different types of tests. There's like traditional blood tests where you just go to the lab and get a blood draw. But there are also a bunch of rapid tests where you can do a swab, a cheek swab, or a finger prick, like when you check your blood sugars for diabetes, like a finger prick like that. And so really easy options for testing. It's important to know that HIV you can't detect an infection immediately after an exposure. So let's say someone had an encounter, a sexual encounter with someone living with HIV, and they come in the next day, they're like, girl, this just happened. I would still tell them to get tested, but they need to get tested again in another couple of weeks, because there's a window period between when infection happens and when the test turns positive. So racial disparities exist. They impact the Black community the most. It's not our fault, but we can be part of the solution. In Pennsylvania, Philadelphia really has the greatest burden of HIV. So having these conversations and talking to Black women in Philadelphia is critical. HIV is treatable. It is not a death sentence. So if somebody gets HIV, they're gonna live a nearly normal lifespan if they get on treatment. We have the secret tools, the secret sauce to really provide this education, to really uplift our community and try to do things in a way to minimize these disparities.